A very good afternoon. I'm Aisha and I'll be your host for today's webinar. Kindly note that this webinar will be recorded. It is my pleasure to welcome you to our monthly ACTRIS cell therapy lecture series. Today's lecture focuses on the role of cord blood in cell therapy. Let's welcome Mr. Arun Prasad, our distinguished speaker for today's webinar. Mr. Arun is an accomplished director of Singapore Cord Blood Bank. Being a member of Quality Standards Committee in Cord Blood Association, Mr. Arun has over 15 years of experience in quality management, international accreditation, and regulatory compliance in the cord blood banking and cellular therapy industry. Mr. Arun holds various appointments, one of which includes being a member in the advisory committee to Ministry of Health. In developing therapeutic biobanking regulations, hematopoietic stem cell transplant standards, and tissue banking regulations. He is also a member of World Marrow Donor Association Standards Committee and Cord Blood Working Group, and an inspector to the accreditation for stem cell donor registries. So just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the Q&A window. Mr. Arun will address these questions after the presentation. And now, without further ado, I will hand the time over to Mr. Arun. Mr. Arun, please. Mr. Arun, could you please unmute yourself? Yeah, thank you.
Thanks for that kind introduction, Aisha, and everyone who are joined in. Thanks for your presence here today, especially the noon time where the lunch time is. I don't want to disturb too much of your time. Let's go on straight away to explore some of the opportunities where cord blood to offer in the field of cell therapy. I will be giving an overall perspective of the role and the product as it is, like a cord blood as a starting material for the manufacturing of therapeutic goods, especially in the field of cell therapy industries or immunotherapy. So this is the basic behind the cord blood, because it holds hematopoietic progenitors. These are actually the baby's blood, which are circulating in placenta. So after the baby is born, the leftover blood retains in the placenta, which are usually discarded as a bio waste after the delivery of baby. So this has a potential role in regenerative medicine, especially the exploded in late 1980s, where the first cord blood transplants were performed in 1988. So until now, the most prominent role of cord blood is in the field of cell therapy is for hematopoietic reconstitution, because it holds hematopoietic progenitors or stem cells in cord blood. But after 2010 or maybe 2011 onwards, I think there have been other areas of explorations to test whether the cord blood has potential to treat other diseases, which is of homologous or non-homologous applications. So this started the process of banking in more effective way. But in nutshell, cord blood banking is a very simple procedure starting from collection. So the donor here is actually the baby, the neonate. Since it's not born yet and it is not a legal age to give a consent, the mother becomes like a surrogate for consent. So once the mother gives a consent and the doctors verify upon delivery, the cord blood is collected after the baby is born. So usually on an average volume of 100 to 120 ml, the cord blood retains in the placenta, which can be collected and transported to the laboratory in a validated containers to minimize the temperature excursion, so that it still maintains its functionality. So once it reaches the lab, the product is evaluated for its quality and quantity, and the concentrated nucleated cells are separated using CPACs or any other cell processing equipment or even a manual method. So the principal goal is to remove platelets, plasmas, on RBCs, and we concentrate the nucleated cells, which also has a host of hematopoietic progenitors in that population. So these cells are concentrated and cryopreserved for long-term storage. So until there is a match available for this particular unit to a patient, it will be retrieved and transported in a liquid nitrogen phase dry shipper in anywhere across the world and to the transplant center. So this is the overall cord blood banking process, which are purely intended for the therapeutic purposes, especially the hematopoietic reconstitution. So the cord blood banking industry has a lot of partners or stakeholders where there will be a linkage of transplant and cord blood banks are linked through a registry, which is a stem cell registry, which also holds the adult donors for bone marrow and peripheral blood stem cell harvest. So what I have mentioned is the role of cord blood, where it performs donor evaluation and assist in collection of cord blood and perform all the testing parameters required for banking as per the laws and international standards. And these units will be listed in an international registries. So the registry's role is to find a match between the patient and the product. So either it can be an adult donor or a cord blood product. The match is purely performed on the HLA level matches. Then for a cord blood, because this is already an off-the-shelf product which is banked in a bank, the transplant centers pick the product based on the level of HLA match as well as the cell dose. So in a typical cord blood banking or public cord blood banking, we process around 15 to 20% of collected cord blood. The remaining 80% is either distributed for researchers for even the normal basic research up to the clinical trial. So there are opportunities where the non-bankable units are being explored for use for other purposes. So as I said, the cord blood is purely used for homologous application for hematopoietic stem cell transplant, and there are over 440,000 transplants performed since 1998 or 88 from an related cord from unrelated cord in mid 90s. So we have 40,000 transplants and its outcome where the researchers and the clinicians have enough data, the post-transplant outcome data, to determine more appropriate cord for different kind of diseases to be picked. And the advantage of cord blood over adult cells is it doesn't require a strict HLA matching. So usually in a typical adult cells, they go with a 10 or 10 HLA, but for cords, I think 6 to 8 is more than sufficient to provide a proper engraftment. And also it provides a low incident of GVHDs so that the patient management post-transplant is very well managed when there is a cord blood transplant. And graft versus leukemia effect is also higher, so that once this engrafted, it has a long-term survival, and the relapse rates are quite limited compared to the other cell source. And since the quality of collection, which is, as I said, around 100 to 120 ml, which have maybe 1 billion to 2 billion cells, which is more optimal for as a graft for treatment of pediatric patients where the weight is comparatively less than for adult patients. And also it provides a long-term disease-free survival, especially when there is a residual effect of post-relapse from another source of stem cells. So this is an alternative source. And also the procurement of cord blood is much more quicker compared to adult donor transplant. So usually within a turnaround time of 3 to 5 days, a product can be selected and distributed to the transplant centers anywhere in the world. So there are, as I said, there are 3 common sources, but both adult stem cell source like PBMCs and bone marrow are the primary source because it is from a live donor. You can harvest the required amount of cell dose for the patient. Unlike a cord blood, it is a one-time collections during delivery, and it is also a banked product. So the cell dose limitations are a kind of slightly a disadvantages for the cord blood. So that is the reason why the engraftment day from day 0 of infusion, usually cord blood takes around 24 to 26 days of engraftment, where it's very crucial for our patients to get any secondary infections and succumb to the diseases. But unlike adult source, which only takes 2 weeks to engraft, so the level of exposure to an external infections is much more less in adult source. So as a source of cells, we have over 40 million unrelated donors registered in the international donor registries in 659 countries. These are listed in World Marrow Donor Association search and match algorithm. And 0.8 million of cord bloods are currently available for transplants and also listed in WMDA. And if you see the number of public cord blood banks is limited to 41 countries. and these are potentially used for homologous applications. So in Singapore, we have around 150,000 registered adult donors, and in cord blood bank, we have around 13,000 cords in the inventory. So this is a last year annual report from World Marrow Donor Association. If you see the contribution of 3 different cell types, like bone marrow, which is the bottom part, which remains around or less than 5,000 transplants a year, but may cord blood is more of a supportive, plays a supportive role if the patient couldn't find a perfect match from adult donor registries. So on an average, we have around 3,000 to 4,000 transplants between 2008 to 2015, but the cord blood is as a source as becoming a plateau and still a contributing factors around 25,000 transplants, 2,500 transplants a year. So, the cord blood banking industry, especially the public banking through WMDA, which allows us to provide this product anywhere in the world. So we can import products from overseas and also export products to any patients across the globe. So this is as an international network where the products have been transported cross-continental. So the common area of homologous applications is blood cancers and disorders, where leukemias, lymphomas, and anemias have been treated as a hematopoietic reconstitution method. And there are also other immunotherapies and genetic and metabolic disorders also been explored, but they are in quite small numbers. Okay, so that is a role of cord blood as a cell therapy, but in a homologous environment where the transplant happens. But there is also another side where the clinical trials have been advancing as a cord blood as a source of cells. It may not be a stem cell source of material for developing other cellular therapy products. So the stem cells are generally categorized into 2 broader categories based on its functionality and sources of tissues. And perinatal tissues, which is from the tissues after the baby is born, or postnatal tissues, have been widely explored because it is less controversial to procure, and these are considered as a medical waste after the baby is born. So the procurement is much more easier and ethical compared to an invasive procedure. So if you look into the perinatal tissues, as I said, cord blood has been widely explored, and now it's licensed under US FDA. They also have a biological license, biological license since 2011. So we have more than 10 years of regulatory compliance for cord blood as a source of stem cells for treating blood cancers. But if you see the other cell types for source of mesenchymal stem cells, it can be used in cord tissues, amniotic membranes, or placenta itself. So these are also being explored for the different sources of stem cells in cell therapy industry. So what is the unique property of cord blood? Why it has been more debated topic in cell therapy industries? Because of its rich and high proliferative stem cell potential, like the HPC are highly proliferative because it's from a naive and pediatric source, and they are less mature, as I said, because it's from a fetus. And availability. So we every day we have births around the globe, and even if you see, we have around 40,000 deliveries in Singapore. So these are all potential sources of stem cells. It can be readily made available when the mother gives a consent and donates a product for clinical applications or research. So the collection, testing, banking are all been well established, and it has been regulated. So when a researcher procures a cord blood product from an established cord blood bank, I think they no need to worry about the validation part from the collections to the receipt from their research facility. So it's more established already. And also the researchers do not need to worry about approaching or writing a IRB to a donor recruitment or collection of product and collection methodologies. So simply they can approach to a cord blood bank, which have been already licensed by ministry. They can be an extended use using a research consent, which the cord blood bank already has established. And when it comes to the safety, there is no safety risk to the baby or the mother because of this donation. So it is widely accepted as sources of stem cells for for research and other clinical trials. So as I said, consent in SCVB at least, and in most cord blood banks, especially the public cord blood banks, they have a two broader consent. One is purely for hematopoietic reconstruction, which is the public banking side, where it will be purely used for listing the unit for unrelated transplants. But on the other hand, if the unit is not eligible for public banking, which I said around 80%, mothers have opportunities to give a consent for research, especially in a broader area, because we do not know what the researchers want. This is not a focused consent. So this is a broader consent, and mother gives a consent so that the researchers can procure this product and also get their ethical approval based on the consent signed by the mother for use in their any relevant clinical trials or in biomedical research. Okay, so one of the product which SCVB explored, at least the use of cord blood plasma. So this plasma has potential source of growth factors and cytokines, which have been explored in treatment of other regenerative part. But cord blood as a platelet poor plasma, the plasma alone is extracted. Even platelet free plasma is extracted and been filled in a tubes where it can be potentially used as a source of eye drops for patients, especially the chronic eye syndrome patients, where the autologous plasma are not a viable option for them. So right now we have over 60 patients enrolled in this program, and we have distributed over 110 packets of platelet poor plasma for treatment of dry eye syndrome. And we are also currently working on a product which is a platelet lysate, cord blood platelet lysate. So that is also a byproduct from PPP, which is a platelet poor plasma. So these concentrated platelets are also being explored to use in other ophthalmological conditions, as well as the treatment of diabetic foot ulcers. So it's a topical application. So once the product is collected and the donors are evaluated and the quality assurance team and medical eligibility is clear, this product can be potentially used in the treatment of diabetic foot ulcers as a topical gel. So the next area which I'm going to just brief is on the starting material for iPSCs, because iPSCs have been on a hot topic for a while, and I think more or less now there's an established protocol available in the industries to develop. But the starting material can be from either an autologous or even from an allogenic. So there are a lot of researchers have been exploring the use of already an established product from cord blood banks, either it can be a cryopreserved products or a fresh product as a source of starting material, either for cellular therapy or to develop a homologous iPSC bank. That means even if that is like based on the country's diversity, HLA diversity, you can pick a more common haplotype type of product. It can be induced and can be having a pluripotent stem cell bank, so that it can be readily available for less level of matched treatment for hematopoietic stem cells, and also for NK cell productions. So there have been a lot of research and publications using cord blood as a source of iPSC derived NK cells in regenerative medicine. And also this paper is purely for developing a blood bank with O-type blood group or negative blood group using an iPSC as sources as cord blood. So once you have this cell line established and you can have a universal donor, so you no need to just work it out about the donor availability. So this is another level for transfusion medicine to develop and induce pluripotent stem cells through cord blood, because the cord blood CD34 cells are much more widely explored for past 20 years. Other part is is on cord blood as a source in T cell products or CAR T production. So this is also latest publication exploring and differentiating the potential of CAR Ts in using an umbilical cord blood as an allogenic source of stem cells. Okay, so banking perinatal tissues, any perinatal tissues for different applications are been widely explored, especially in last 10 years or 15 years. So cord blood banks, which have been established purely for stem cell transplants, have been now converting more or less its operations to a therapeutic biobank, where it provides a sources of cells and tissues for researchers and clinicians to develop other advanced cell therapy products like here gamma delta cell therapy, CAR Ts, and haplobank using iPSCs. And also established immunotherapy modules like Treg preparations and CTL cell source. So these are also been, because there are a lot of publications which I don't want to spend more time to present. So I'm just giving a summary of the areas cord bloods are currently used or explored. I think the third one, which is the neurological applications in pediatrics, which has already been like phase 2, phase 3 clinical trials are growing for cerebral palsy and autism. So in last like 8-10 years, these have been widely explored, and now they are moving towards the last stages of the clinical trial. And I didn't talk much about cord tissue because that's another topic where it need more intuitive discussions on the sources, the cord tissue as a source of master cell bank preparation for mesenchymal stem cells. So once it has been established as a source of like a cord blood bank, any researchers can procure this product from a master cell bank to have a working cell bank and manufacture their own therapeutic products. But right now, these are not widely established, so the researchers still depend on writing an IRB to procure cord tissue, because there is no cord tissue bank or mesenchymal stem cell master cell bank available for readily use in the field of regenerative medicine and cell therapy. So by summarizing, there are the 4 critical elements on cord blood and its potential to use in cell therapy. One is the high proliferation rate and less immune rejection, cord blood industries, and also we have a non-invasive protocols to procure this product in an established cord blood bank. And if you look into the progression of cord blood and cord tissue in cell therapy and its clinical trials, it's been on an upward trend. I think this will go on maybe for another 5 to 10 years to find a lot of a licensed product from this stem cell source, and it can be established a cell therapy product in upcoming years. So both public banks and private banks play a role, but the advantage of public bank is the donated product, the consent is already obtained upfront, and there is no financial obligation by the public bank to the donors, so it's all disclosed upfront. So either if it's a good product for high cell dose, it will be used for hematopoietic stem cell transplant. If slightly lower cell for cord blood banking, can be rechanneled and manufactured for other cell therapy product cell lineages, which you can see here. So the quality standards. So how does the researchers or the physicians trust the sources of stem cells or the regulators? So it has been a highly regulated industries because of the homologous applications. There are a lot of international accrediting bodies like ABB and FACNet Cord and CAP for accrediting the laboratory operations or cord blood banking operations. And also the ministry licensed the cord blood bank under Healthcare Service Act. And for SCBB, we are an IND. We have an IND with US FDA through a National Maradona program to provide products for US patient, because in US the cord blood is a licensed BLA product. And all our registry activities, we also support transplant for patient and product transplant match through the accreditation of WMDA. Okay, thank you. I think that's the overall role of cord blood in both homologous and non-homologous applications. Any questions, I'm happy to answer.
Thank you, Mr. Arun, for a very detailed and elaborate presentation on your work. We'll now proceed with the Q&A session. So there's one question here from Charles Wang. It says, I would like to ask, what are the reasons that 40 to 50% of cord blood fail to meet the criteria for banking? And secondly, how can we procure the donated cord blood for research purpose? A detailed guideline will be useful. Thank you for your presentation.
Okay, I'll address the first part. The cord blood banking, as a donor center, the bank operations has a lot of operational costs. So the bank will decide based on the clinical implications, like what doctors want, what kind of cells have been procured for transplant. So based on that, the operation have been actually explored. So based on that, the acceptable criteria for cord blood banking, say for example, for SCBB, we have 1.2 billion cells. So the product collected should have at least 1.2 billion cells in order to meet the requirement of both pediatrics and adult transplants. But if you bank all the product collected, even with it like less 500 million cells or 800 million cells, the cost of operations is still the same, but the product will not be, or the chances of usage of that product will be much more less compared to the high cell dose, because the cell dose plays a major role in treatment. So that is the reason why we have acceptable criteria. It can be a low volume. The reason the cord blood may not be processed, or it is low cell count, the cord blood may not be processed. So in order to meet that criteria, so around 20%, 50 to 20% of our collections meet those acceptable criteria, so it is being banked. So that is the one reason why majority of the units are not banked. The second question is, I mean, SCBB is providing cord blood for research since 2007 onwards. But with the implementation of HBRA and human tissue framework in last 2 to 3 years, we have been declared biobank for research under MOH. And if you go to SCBB website under researchers, you can know the overall process of procuring cords for research, or you can simply write to SCBB. I can just in the chat provide an email address, so anyone who is interested to explore, they can actually reach out to us, and I will channel it to the right person to I mean, I'll just chat in the chat window. I will send the email. So when you write to us, and we will provide relevant forms and documents and procedures to procure cord blood for research. I think the overall summary is still available in our website under healthcare providers and research, so that you can know the basic understanding, the requirements, and so on.
Arun, we have another question from our audience, from Nelly Keen. Thank you for the insightful presentation. Are there any checks required on a molecular level to ensure the quality of the cord blood?
So molecular level, we do on like a newborn screening. So we do test for hemoglobinopathies, but purely on a protein level. So we do test for hemoglobinopathies in order to determine the eligibility of cord blood product. And other testing we perform is purely HLA. So these are the two so-called molecular explorations which we do on cord blood product. Other than that, it is more on addressing the family medical history of both the parents. Is there any abnormalities during the delivery of baby? Because we can't do all genetic tests in order to do a cord blood banking eligibility. So we depend on donor health history, family medical health history, and physical assessment of the baby upon delivery, and post delivery assessment. So we do this kind of an evaluation before we list the product in international registries.
Thank you, Arun. At this point of time, I don't see any further questions from the audience. So Arun, would you like to maybe share some interesting facts to wrap up your presentation?
The interesting facts, I think first thing is many people are not aware there are sources of stem cells available in Singapore to be used for their research, because I've seen a lot of people are writing their own procurement protocol and find alternative source of stem cells in order to even start the research program. So what I can say here is we have already established a research tissue bank apart from the clinical service provider. you can approach us. If you wanted to start with a simple basic explorations of your protocols or even validation of your equipment, you need a source of stem cells of blood products. We are happy to help. And also at the final end, if you wanted to be in compliance to the CTGTP regulations under Health Products Act or HSA requirements, we are also happy to provide those until that level of support for a cord blood as a source of stem cells for your research.
Right. So as there are no more questions from our audience, we will wrap up our session. On behalf of ACTRIS, thank you very much, Mr. Arun, for this enlightening presentation. And to all our audience, thank you for attending today's lecture. And we hope to see you again in our next lecture on the 21st of October. So have a good afternoon, everyone. Thank you.